10 to 15% of US adults have gallstones.
It sounds like gallstones can be very painful. But first, what is the gallbladder?
While the common term is a gallbladder attack. If the body is unable to pass the gallstone,
Infections of the gallbladder can be very severe. How are gallstones or problems with the gallbladder diagnosed? Cholecystitis, or severe infection of the gallbladder, is treated with antibiotics and often surgery. Choledocholithiasis, or stones stuck in the liver ducts, can lead to an infection that can be treated by removing the stones by ERCP. How can you prevent gallbladder pain or gallstones from forming?
welcome back. Today's talk is focused on everything related to the gallbladder, including what the gallbladder's job is, stones in the gallbladder, pain and dysfunction of the gallbladder, and lastly, infection of the gallbladder, which is what I particularly worry about as an ER physician.
This sounds like a high-yield talk, but first, what is the gallbladder?
The gallbladder is an organ that is inside the right upper part of your abdomen, right next to the liver and the pancreas. It stores bile, which is a green substance produced by your liver that aids in digestion. The gallbladder stores and concentrates the bile before releasing it into the small intestine, where it helps digest fatty foods.
The gallbladder helps release bile to break down the food I eat, especially fatty or fried foods. What are gallstones then?
Gallstones are abnormal stones that form in the gallbladder when bile becomes too concentrated or your body is making too much cholesterol or other substances. Many people have gallstones and remain asymptomatic, never knowing they have them. It's estimated that 10 to 15% of US adults have gallstones.
Gallstones seem pretty common. When do gallstones cause pain?
Gallstones cause symptoms when they travel through a duct or tube that connects the gallbladder to the small intestine. The gallbladder will usually try to secrete bile into the small intestine to help with digestion after you eat a fatty meal. When this happens, sometimes a gallstone will try to pass in the small intestine along with the bile. If a gallstone is too big to pass, severe pain can occur. This pain is from the spasming of the gallbladder that contracts and tries to pass the stone into the intestine.
What does gallstone pain feel like?
Pain from gallstones is usually in the right upper area of the abdomen and can radiate to the back and the right shoulder blade. It can be very intense and it can take your breath away. Gallstone pain can also cause nausea, vomiting, indigestion, belching, diarrhea, and sweating. The medical term for gallstone pain is biliary colic, while the common term is a gallbladder attack. If the body is unable to pass the gallstone by contracting and spasming the gallbladder, serious complications can occur.
It sounds like gallstones can be very painful. What kind of complications can occur from a gallbladder attack?
The gallbladder can become infected, something we call cholecystitis. This can occur with or without gallstones being present. A gallstone stuck in the liver ducts, or choledocholithiasis, can cause buildup of liver breakdown products like bilirubin. Bilirubin accumulation can then lead to jaundice or yellowing of the eyes and skin, nausea and vomiting, itching, pale-colored stools, and eventually serious infection as well. Infections can be severe. If infection is present, you can develop fever, chills, confusion, sepsis, shock, and many other symptoms that can become life-threatening if not treated. Another known complication arising from the gallbladder is pancreatitis, which we'll save for another talk.
Infections of the gallbladder can be very severe. How are gallstones or problems with the gallbladder diagnosed?
Gallstones and problems with the gallbladder can be diagnosed by a combination of a history and physical exam by your doctor, blood testing to check for signs of bilirubin buildup or infection, and imaging testing. Imaging tests like an ultrasound or CT scan can check for signs of blockages from gallstones or infections developing in the gallbladder or bile ducts. Problems that don't show up on these tests may show up on a HIDA scan, which uses nuclear medicine to check gallbladder function.
How are gallstone blockages and gallbladder infections treated?
Gallstone blockages usually require a procedure called ERCP, or endoscopic retrograde cholangiopancreatography. ERCP can remove a gallstone and restore the flow of bile into the small intestine. This is performed by a specialist like a gastroenterologist or surgeon. If infection is present, IV antibiotics are also given. If the gallbladder is infected, again, cholecystitis, surgery may need to be performed to remove the gallbladder by a specialist like a surgeon. Gallbladder removal or cholecystectomy is one of the most common surgeries in the United States.
Let's recap. Gallstones and gallbladder complications are usually diagnosed via ultrasound, CT scan, or HIDA scan, along with physical exam and labs. Cholecystitis, or severe infection of the gallbladder, is treated with antibiotics and often surgery. Choledocholithiasis, or stones stuck in the liver ducts, can lead to an infection that can be treated by removing the stones by ERCP. How can you prevent gallbladder pain or gallstones from forming?
There are many risk factors for having gallbladder problems and gallstones, including advanced age, female sex, diabetes, and being overweight. Remember, bile is secreted from the gallbladder when you eat fatty foods, and gallstones can form if there's too much fat or too much cholesterol in your diet. Eating healthy foods that are low in saturated fat and getting regular exercise can help to prevent gallbladder pain.
Many risk factors contribute to gallstones and gallbladder pain, including female sex, obesity, advanced age, and diet. What are examples of foods to avoid?
That's a great question. Fried foods, fast foods, highly processed foods like cookies, donuts, pies, whole milk products like butter and cheese are all high in saturated fats and cholesterol, and they can all contribute to gallbladder problems. Whole grains, vegetables, lean meats are much less likely on average to cause problems. And that sums up our talk on gallbladder. Remember, none of this information should override or replace the recommendations of your doctor. We are not personally taking care of you or evaluating you. If you're concerned about an emergency or a serious medical condition, please call 911. Keep tuning in for more information about common medical conditions, and don't forget to like and subscribe if you found our content helpful.